Welcome to Influence of Significant Others on Work Participation of Individuals with Chronic Diseases. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. Our guest speaker today is Nicole Snippen. Nicole Snippen is a third-year PhD student at the Department of Health Sciences of the University Medical Center Groningen in the Netherlands. The focus of her research is on the influence of significant others, such as partners, family members, and friends, on work participation of workers with a chronic disease. She is particularly interested in how healthcare can be improved by involving significant others. Currently, she's developing an e-learning training for occupational health professionals on how significant others can influence work participation and how to address this in occupational healthcare. Additionally, she's developing a conversation tool with accompanying materials that occupational health professionals can use to assess how significant others influence the worker and to facilitate a positive influence. Nicole, welcome. Thank you so much for presenting this webinar all the way from the Netherlands. I'll let you start without delay.
Thank you so much for the introduction and also for the invitation to tell something about my research today. First, I'd like to thank the team that I'm working with, of course, because I couldn't do this on my own. Sandra Brouwer, Heitse de Vries, Mariette Hagedoorn, and Sylvia van der Burg Vermeulen, thank you so much. And of course, I'd also like to thank Instituut GAK for funding this project before we dive into it. So in recent years, the emphasis in healthcare has shifted more towards self-management and adapting to a chronic disease, aside from focusing on curing a disease and reducing symptoms. With this shift, the role of occupational health professionals has also changed, as more emphasis is being placed on supporting workers to manage their condition and also to strengthening their ability to continue working or return to work despite the condition. We also know that various factors are important in this context, including personal factors, but also factors in the work and social environment. As mentioned before, I focus specifically on the influence of significant others, and then even more specifically on the partner, family members, or friends, and then on work participation of workers with a chronic disease. So this is what I will focus on for the rest of this webinar as well. So as I mentioned, we know that significant others, such as a partner, family members, or friends, can be an important resource for individuals to help them successfully adapt to a chronic disease and also to manage one's own working life. However, they may also be an important barrier. We therefore believe that occupational health professionals can better support workers in their self-management and also in their ability to work by explicitly paying attention to the influence of significant others in occupational healthcare. However, currently no education and tools on this topic are available for these professionals. Therefore, in my project, we aim to develop and evaluate an e-learning training and conversation tool for occupational healthcare professionals to better support self-management and adaptation of chronically ill workers by addressing the influence of significant others in care aimed at return to work. Just shortly, the aims of this webinar. I hope that after this webinar, you will know that illness representations, appraisals, Communication and coping of workers and their significant others can influence individual and relationship outcomes, including work outcomes. Furthermore, I will go into how these concepts can be addressed in occupational healthcare to promote self-management and work reintegration. To illustrate how workers and significant others might cope with a chronic disease, I'd like to start with an example based on the principles of the cognitive transactional model of couples' adaptation to chronic illness of Bader and Acitelli. To do this, let me introduce you to Harry and Lisa. Harry and Lisa have been living together in relatively good health for 10 years when Harry is diagnosed with a chronic disease. At first, they may be in shock and not understand the implication of the diagnosis. They may ask themselves questions such as, what is happening? How bad is this? And what can I do about it? This in turn will influence how each of them will cope with the situation. For example, in case of diabetes, Harry may decide to follow his doctor's recommendation to exercise more and to change the diet. Lisa may want to help Harry, but maybe she doesn't know what she could do. She might therefore unwittingly buy food that does not fit in with Harry's new diet, and therefore making it harder for him to adhere to it. She might also be overly concerned about Harry and pressure him to take it easy and not to go to work. This in turn may influence Harry's self-efficacy or his confidence in his ability to follow his new diet and also with regard to work. And this may consequently influence his health and its work outcomes. Aside from their individual coping efforts, as I described before, Harry and Lisa might also talk about how they can deal with this situation together. They could, for example, discuss how Lisa can support Harry with his diet and exercise, while Harry might try to take away some of Lisa's concerns. The different ways in which two people interact and work together to manage the illness-related stresses is often called dyadic coping. Dyadic coping does not replace individual coping, but rather exists next to the individual coping efforts. As with individual coping, dyadic coping can influence Harry's and Lisa's individual efficacy, but also their dyadic efficacy, thus their confidence in their joint ability to manage the situation and the illness-related stressors. This, in turn, can influence not only their individual outcomes, but also their relationship outcomes, such as their relationship satisfaction. We believe that professionals can better support workers in their self-management by explicitly paying attention to these processes, including cognitive and behavioral factors, so the thoughts they have and how they respond to the situation, and also the interactions between workers and their significant others. When discussing the relevance of the influence of significant others in the context of occupational healthcare, we can look at some different sources of information. I will briefly discuss some of our main findings from these different sources, namely current guidelines, views and practices of occupational health professionals, views of workers with a chronic disease, and of their significant others. First, when we look at guidelines for occupational health professionals, we see that the possible influence of the social environment is frequently mentioned. In some guidelines, professionals are also advised to address environmental factors and sometimes even to involve significant others such as family members in treatment and care. However, not much, if any, attention is being paid to which factors professionals should pay attention to. When we look at the views and experiences of occupational health professionals, we see that they recognize that significant others can influence workers and reintegration. However, in a survey study we conducted in the Netherlands, we also found that it is not common practice for most occupational health professionals to address significant others' influence on work outcomes and their cognitions and behaviors. The only exception was practical support, which is frequently assessed by a lot of professionals, but this is not the case for many other factors that might also influence work outcomes. Our results also indicated that the possible benefits of assessing significant others' cognitions and behaviors, and therefore their influence on work outcomes, that this may depend on certain situational factors, such as the goal of the consult, think about reintegration versus claim assessment, but also case-specific factors. Occupational health professionals indicated that they do not always find it necessary to assess the influence of significant others. For example, when the worker is coping well and the professional feels that this would not contribute to better care. A few intervention studies in which significant others were involved in treatment also mentioned that the effects of involving significant others in healthcare can depend on certain circumstances. And also in the context of occupational healthcare, we also see that occupational health professionals mention barriers in the occupational healthcare system, such as lack of time, but also resource and training opportunities might play a role in why professionals do not always pay attention to this. When we look at the views of workers on involving significant others in occupational healthcare, we see that in general, workers are positive about the possibility of involving significant others. Workers do indicate that it is important that the aims of involving a significant other should be clear and that this also should be related to work. The preferences with regard to involving a significant other differ between workers. Some workers prefer to involve a significant other or more than one, while other workers prefer not involving a significant other. The last might be the case if they prefer to deal with the situation on their own, or because they might not want to burden their significant others. Significant others also differ in their preferences, whether or not they would like to be involved or not. Some indicated that they would like to know more about what is being discussed with the professional, while others indicate that they don't feel this need or have other reasons for why they would or would not be want to be involved. Both workers and significant others do feel that the worker should have the final say in whether or not a significant other. So even if a significant other would like to be involved, if the worker would prefer not to involve them, both say that the worker's preference should be central. Based on the previous findings, we feel that the most important factor in deciding whether or not and also how a significant other should be involved is the worker's preferences and his or her circumstances. It might be that the worker would prefer not to have a significant other present during a consult, or that a significant other is not able to join a consult. In this case, a significant other might still be involved in a different way, but not being present at a consult. For example, by providing some information for both the worker and the significant other. The worker's wishes should also be respected if he or she does not want to involve a significant other at all. It is therefore important to inform the worker of the possibility of involving significant others and also to explore whether the worker would like to involve a significant other. As mentioned before, the benefits of involving significant others appear to depend on various circumstances. Based on our research, we think it is especially important to involve a significant other when it appears that the worker is not coping effectively with the illness-related stressors. For example, when reintegration, when there is stagnation in the reintegration. In this case, it can be valuable to explore if significant others are responsive to the support needs of the worker and also if their dyadic coping is effective. As mentioned before, we are currently developing an e-learning training to educate occupational health professionals in when and how to involve significant others to facilitate work participation. This e-learning training will be in part based on the principles of the cognitive transactional model of couples adaptation to chronic illness of Bader and Astelli, but also, of course, on our findings in previous studies. Based on this, we feel that two factors related to individual and dyadic coping processes are most relevant in the context of occupational healthcare. These factors are illness perceptions of the worker and significant other, and communication and interactions between them. We are currently still working on the content of the e-learning training and how these factors can be addressed by occupational health professionals, but I really like to already give you some ideas on how these topics can be addressed. So I will present some preliminary recommendations that we have in mind. First, I will go into the role of illness perceptions of the worker and the significant others. We know that when people are confronted with a chronic disease, they often ask themselves questions on 5 different dimensions. What is happening? What are the consequences? How long will the illness last? What can be done about it? And what caused the illness? Their thoughts and perceptions on these topics are their illness perceptions. These perceptions are based on someone's own ideas, their knowledge, and their assumptions, but they can also be influenced by, for example, doctors, significant others, social media, and information from other sources. Research shows that illness perceptions give direction to how a person copes with complaints and health problems in daily life. We also know from research that adequate and positive illness perceptions are related to more positive outcomes, for example, with regard to health and work. On the other hand, misperceptions or negative illness perceptions seem to be related to worse outcomes. Overall, we can say that people with positive and adequate illness perceptions function better in daily life and experience less disease burden than people with negative or inadequate illness perceptions. Some workers and significant others have illness perceptions that will lead to adequate or adaptive behaviors, while others have illness perceptions that will lead to inadequate or maladaptive behaviors. If we go back to the example of Harry and Lisa, we can already guess at some of their illness perceptions. For example, Harry's decision to change his diet and to increase his exercise suggests that he probably believes that lifestyle can influence his illness and that he can also influence his complaints by making changes in his lifestyle. On the other hand, Lisa seems overly concerned about Harry and thinks that as a consequence of the disease, Harry should not work. She might even believe that the disease should first be cured before Harry is able to go back to work. In this example, we might say that Harry's illness perceptions are positive and adequate, whereas Lisa's illness perceptions are negative and maybe not even adequate depending on the overall situation. However, even though Harry's illness perceptions seem to be helpful, his perceptions, self-efficacy, and coping might be negatively influenced by Lisa's illness perceptions and also her consequent behavior. It might therefore be helpful for occupational health professionals to address their illness perceptions. Workers and significant others can have various illness perceptions. I already gave some examples with Harry and Lisa, but here are some other examples. It might, for example, concern one's ability to undertake certain activities and also their beliefs and expectations with regard to work, which have been shown to be a very strong predictor of return to work. Professionals can explore the illness perceptions of the worker and his or her significant other in various ways. A professional can, for example, ask questions about the different dimensions of illness perceptions, so cause and consequences, for example. But he can also obtain information about the illness perceptions by having them fill in the brief illness perceptions questionnaire. This is a questionnaire, a short questionnaire of about 9 items, and it is freely available in more than 20 languages. And this might be a good starting point to discuss any negative or inadequate illness perceptions that may exist in the worker and significant other. Also, when a significant other is not able to attend a meeting with the professional can still obtain information about a significant other's illness perceptions. For example, by asking the worker about how his or her significant other thinks about a certain topic. We know from professionals in other fields that people are generally quite able to say how a significant other thinks about a certain topic. So this might be a solution if a significant other is not present. It might also be possible for a significant other to answer a short questionnaire or answer some questions prior to the next appointment with the worker. For example, through an online portal, if this is being used by the professional. Prior research indicates that illness perceptions can be changed in quite a short time. If there seems to be inadequate or unhelpful illness perceptions, professionals can try to challenge these illness perceptions. For example, by discussing them with the worker and significant other, or by giving them information related to these inadequate illness perceptions. Then the role of communication and interactions between worker and significant other. A worker and a significant other can interact in different ways as they manage illness-related stressors. On the one hand, they may try to support each other or try to collaborate in managing the new situation, but on the other hand, a significant other may be very concerned and overprotective. Or the worker may try to buffer the significant other from stress and concerns. Significant others or workers may also feel that the illness is something the worker has to deal with on his or her own, and may therefore be uninvolved or even critical about how the other manages the illness. With regard to work outcomes, there is some evidence that open communication, encouragement and motivating behavior, and advice and encouragement to participate in activities such as work from significant others can facilitate positive work outcomes. On the other hand, positive attitudes towards sickness absence and advice, encouragement, and even pressure from significant others can be barriers for work participation. We also found in a review that practical support with daily activities and empathy from significant others can be both facilitating and hindering. And this might be due to underlying processes such as the extent to which perceived support matches the desired or needed support. Badr and Asitelli suggest in their article that when both partners own the illness, so they perceive that it is a shared problem and work to support each other and the relationship, that it is anticipated that this will result in improvements in self-efficacy and dyadic efficacy. And this in turn should be positively associated with individual and relationships outcomes. When we go back to Harry and Lisa, we see that Harry is eager to go back to work and is considering going to work the next day. However, Lisa thinks he should not return to work yet and pressures Harry to take it easy. This might in part be due to uncertainty of Lisa about the extent and severity of Harry's complaints, and whether Harry will be able to manage his diabetes while working. This uncertainty might be increased by Harry's efforts to protect or buffer Lisa from worry and stress by not telling Lisa when he is having a bad day. This leaves Lisa guessing about how Harry is doing. Harry in turn may become irritated by Lisa's overprotectiveness and may also feel that Lisa is not being supportive. It might, in the article, Badr and Astel also state that adaptive communication between partners about a problem may help reduce this uncertainty. It may develop development of shared appraisals and foster dyadic coping. Therefore, to facilitate self-management and return to work, it might be beneficial to also address communication and interactions in occupational healthcare. As mentioned before, people can interact in many different ways. For example, a significant other might try to support the worker by taking over tasks. They may also suggest to take a walk together if the worker has been advised to walk daily as part of the reintegration. On the other hand, workers may not want to bother their significant other and may also not want to talk about his complaints all the time. So it's a fine balance that has to be achieved. Professionals can use different ways to explore communications and interactions between worker and significant others. When both are present during a consult, professionals can observe how the worker and significant other interact and can address these interactions at the same time. Professionals can also ask worker and significant other direct questions on, for example, how they deal with the situation and how they support each other. In this case, it is possible to, for example, use some of the items of the dyadic coping inventory or the active engagement, protective buffering, and overprotection questionnaire. It might also be helpful to give some examples to the worker and professional about how other workers and significant others might interact, and then to ask them if they recognize this. This might help the worker and significant other to express their experiences without asking them directly about how they interact and cope with the situation, as this might be sensitive for them to discuss so directly. Another example of how professionals can facilitate communication between worker and significant other is by advising them to talk about different topics concerning, for example, work and health. Topics can include expectations or worries of each person, needed support and how these needs can be met, and also how they can support each other and work together to manage the stressors. At the next meeting, the professional can then ask whether they discussed these topics and how this went. Of course, if necessary, other topics can also be discussed, just depending on the situation. The professional could also involve significant others in making plans on how to achieve reintegration goals and whether and how significant others can help the worker achieve these goals. although occupational health professionals can facilitate adaptive communication between work and significant others, it's important that they do not take on the role of, for example, a relationship therapist, because that's not his function. And as mentioned before, it's important that the aim of involving significant others relates to work, as this is the main goal of visiting an occupational health therapist. It is not their task to solve severe communication problems, and in some cases, it might be better to refer them to a specialist. So, to briefly summarize the previous recommendations, we advise professionals to first inform workers of the possibility and the possible benefits of involving significant others, and to also explore whether and how a significant other should be involved according to the wishes and preferences of the worker. Second, we advise to explore the role of illness perceptions of the worker and significant other and see whether they are adequate and helpful. And also the role of communication and interactions between the worker and significant other, and see if there are possibilities to intervene on that, for example, to make sure that the needs of the workers for support are being met, and that worker and significant other interact in a positive and helpful way together and deal with the situation effectively. Finally, we advise to facilitate the adequate and positive illness perceptions, as I said before, of both workers and their significant others, and also to facilitate constructive communication and interactions between them. I'd like to end this presentation, this webinar, with 3 take-home messages. First, although significant others can be an important resource for individuals to help them successfully adapt to a chronic disease, they can also be an important barrier, and it's important to take this into account. Second, we believe that when worker and significant others both perceive the illness as a shared problem and therefore own the illness, and work to support each other and the relationship, this can improve self-efficacy and dyadic efficacy, which in turn may improve individual and relationships outcomes, including work outcomes. And finally, we think that professionals can better support self-management and work participation of workers with a chronic disease by explicitly paying attention to these individual and dyadic coping processes in occupational healthcare. I thank you very much for your attention, and I would be happy to answer any questions that you might have.
Thank you so much, Nicole, for this wonderful webinar. So immediately we'll start our Q&A session. So to our attendees, if you have any questions, please insert them in the question box. Our first question here is just can you expand on the definition of dyadic coping?
Yeah, basically, dyadic coping consists of all the interactions that occur between a worker and a significant other. So the different ways in which they interact, that can be supportive, but also they can collaborate and really work together. Okay, how can we deal with this situation? How can I help you? And it's also important to know that it's something that goes both ways. So it's not just the significant other supporting the worker to cope with the situation, but also the other way around. Yeah, does that answer the question?
Perfect. The next question is, what are the factors that occupational health professionals should pay attention to?
Yeah, in some guidelines, there are some factors mentioned. Mostly it's just mainly general, like, okay, significant others can influence work outcomes, or the social environment can influence work outcomes. So it's important to pay attention to without any specific factors being mentioned. I know of some guidelines that do mention, for example, practical support, but also empathy is being mentioned in some guidelines. But it's really, the information provided in these guidelines is pretty scarce. And also in general, the evidence about which factors influence work outcomes is pretty low, because there have been a lot of lot of studies, also qualitative studies about how significant others influence work outcomes, but mostly have been qualitative studies and also very broad, like looking at factors such as social support, which can contain so many specific factors. But I did already mention some factors that we found in our review that were mentioned by multiple articles, such as the positive and encouraging attitudes regarding returning to work or staying at work, but also in general encouragement and motivating behavior from significant others. Maintaining open communication seems very important. And some barriers include the positive and attitudes towards sickness absence, and also advice and encouragement or pressure to refrain from work. Those are factors that have been mentioned as barriers. And as I mentioned before, practical help and empathy, although they are mentioned in some guidelines as well, it's a bit unclear yet if they are not definitively a positive or negative influence on work outcomes. It totally depends on what is desired by the worker, for example, and how the actions of the significant others are being perceived.
Thank you for your answer, Nicole. So next question is, when you talk about supporting self-management, can you give examples in a way to support self-management for people dealing with the chronic disease? And more particularly, are there any examples related to the workplace?
Yes, sure. For example, especially related to the workplace, we know that some workers perceive that they can't really change something in their work to make it possible for them to work, that they don't have these opportunities in the workplace. And significant others can help them support or help them achieve more self-efficacy. Like, okay, can you discuss it with your employer, for example, or with your occupational physician? And significant others might also attend these meetings if possible and desired to help workers really state what they need and also, well, look at the possibilities to get that.
Thank you, Nicole. Next question is, are there any trends of the significant other becoming more involved or the client wanting involvement depending on age or length of time spent in a relationship?
Ooh, I'm not really sure about that. I do know in other fields that it's more common to involve significant others, but I don't know if that really depends on age or time of relationship, so I really can't answer that.
To your knowledge, are there any studies done in that area?
I'm not familiar with them. It might be. I don't think in relation to work, because it's a fairly new topic in relation to work. So not a lot of quantitative research has been done on the influence of significant others. Maybe in other fields, but I'm not sure. I'm not familiar with them.
Thank
It's
you.
interesting though.
Yeah. So another question is, in the case where the significant other has negative illness perceptions, how can occupational health professionals have an impact to change this perception?
Depending on the perception, a professional can discuss this with significant others to really challenge those perceptions. They can also possibly give some information or tell them to look for other information on the internet, for example. Those are some of the ways that professionals can address these illness perceptions.
So, and in the same area, I think, from your presentation, we understand the importance of the a significant other might have on a worker. So what are the methods that occupational health professionals can use to take this in account and to positively impact the improvement of a worker living with a chronic disease?
Yeah, as I mentioned, currently there are not many tools available for especially occupational healthcare professionals. We are currently developing a conversation tool for Dutch occupational health professionals to give them some handholds to, for example, ask some certain questions or, well, what can you do to give them advice on what they can do, but this is still in development. In general, I think it would be good for professionals to pay attention to this by just asking about this and then seeing if illness perceptions, for example, are adequate, and if not, well, how can we change these perceptions? And also, it can also mention like, okay, we know that I understand your worries, so acknowledge, of course, the feelings and thoughts of significant others, but then perhaps also providing something what we know of out of research, like for example, with back pain, we know that a common misperception is that people with back pain have to take rest and that they shouldn't move too much, or maybe that something is damaged in back. While we also actually know that most of the times it's good to keep active and to move the muscles to keep them warm. So that by explaining that, that might also already help take away some of these misperceptions and help workers to actually, and their significant others, to cope better with their complaints.
Makes sense. And how would a occupational health professional get that information to the significant other?
Well, we recommend asking a significant other to um, join a conversation, because then a professional can address this directly and discuss it with both the worker and the significant other. And they might also have different opinions, the worker and the significant other, so then he could address that as well. And otherwise, it might be helpful to just give out a leaflet with some basic information about the condition and what does this disease mean, what is happening, but also how can someone best deal with the complaints. And also, it might be helpful to have the worker and significant other discuss some topics as well by the professional advising, well, maybe you could talk about this, talk with your significant other, how he can support you better, perhaps.
Thank you, Nicole. So you've talked about an e-learning training program. So when would this e-learning program be available?
Yeah, that's maybe a bit difficult because we're developing it in Dutch, because the study takes place in the Netherlands. We are expecting it to be ready for an RCT in the beginning of next year. Yeah, currently there are no plans to make an English version, for example, but that would be very interesting to see if that would be possible at a future time. But yeah, we hope the Dutch version, the evaluated version, to be available somewhere in the next year.
I'm sure it would be very, very helpful in the future as well.
Yeah,
Uh,
I hope
so,
so.
during the development of this e-learning program, so far, what would you say are the facilitators and barriers that you've encountered?
The facilitators and barriers for.
The development of what are the hardships that you've encountered during the development of this e-learning program?
I think the hardest part for me personally is to narrow it down a bit, because we have a lot of information and a lot of things that we feel is important to include it in this e-learning training. But then again, it's kind of a complex topic as well. So we can't really discuss everything. So we also had to make some choices in which topics we will actually address in this e-learning training and on which factors we will focus. For example, what we have chosen is to focus on these illness perceptions and these communication and interactions between worker and significant others. So yeah, that's been difficult for me.
Thank you so much. So, can you maybe summarize 3 recommendations that you would have for occupational health professionals present with us today and listening to our recording as well?
Yeah, sure. I think it's important to be aware that significant others can influence work outcomes of workers with a chronic disease. And it's especially important to look at this influence and assess whether significant others influence or facilitate or hinder work participation, and paying attention to their illness perceptions and also how a worker and significant other communicate. Because I think a lot can be gained by paying more attention to this. And this can be as simple as just assessing this and making some small recommendations or giving some information, or just telling a worker to talk with his significant other about this. Because we also know that with support, for example, a significant other might feel that he is supporting the worker very well, but in the end, if the worker doesn't feel like he is supported or doesn't perceive that support as being helpful, this support is not as effective as a significant other might think, for example.
Perfect. And our last question is, Nicole, for you.
Yeah.
What are the next steps of your research, and what do you think needs to be done in the future? What's lacking in this area?
The next steps of my research basically is finishing the e-learning training and the conversation tool that goes with it. We are going to evaluate this e-learning training in an RCT, a randomized controlled trial study, with a waiting group and an intervention group, to see whether the e-learning training will have effect on knowledge, attitudes, and also skills of professionals. Next, we also want to evaluate using the conversation tool that we're also developing in practice. So how do professionals experience working with this conversation tool, and what can be improved? So that's very exciting for me, because it gets really practical at this point. I think it is important to have more quantitative research on specific factors of significant others that can influence work outcomes. So I think that is very important, and it would be also very nice to maybe make an English version at some point of the e-learning training, but that's more future, long-term future, I think.
Perfect. So thank you so much, Nicole, for your valuable insights on how occupational health professionals can help by better support in self-management and work participation of workers with a chronic disease by addressing individual and dyadic coping processes in occupational health care. Thank you so much for your time and accommodating this webinar all the way from the Netherlands. So we appreciate that. And to our audience, thank you again and always for your attendance.